here today to talk about stroke, knowing the signs and prevention, and we're going to know what the acronym FAST stands for. So, what is a stroke? A stroke is often called a cerebral vascular accident, or short for CVA, or brain attack. It is a loss of blood flow to an area of the brain which may result in disorientation, further injury, or even death. When blood flow ceases, brain cells are denied vital supplies of oxygen and nutrients. Some strokes may produce only a slightly recognizable effect, while others can quickly cause the loss of function of an arm or a leg, or even death if coma results. Alrighty. So, what is a stroke? A stroke happens when oxygen carrying blood is blocked from reaching the brain. Brain cells begin to die. All strokes are sudden. So as you can see here in the picture, this is where the blood cells are not getting oxygen and they're dying. So you see right here how small that looks and how dangerous a stroke is. So the types of stroke: ischemic, which is a blood clot blocks a blood vessel in the brain. And hemorrhagic, a blood vessel bursts and leaks blood into the brain. And there's also transient ischemic attacks, or known as TIAs, mini strokes. Symptoms last for a short time. TIAs, or better yet, mini strokes, are still a medical emergency. What disabilities can result from a stroke? Although stroke is a disease of the brain, it could affect the entire body. The effects of a stroke can range from mild to severe and can include paralysis, problems with thinking, problems with speaking, and emotional problems. People may also experience pain or numbness after a stroke. So some signs and symptoms. All major stroke symptoms appear suddenly without warning. You may not know you're having a stroke because a stroke damages the brain. So for example, we know if we're walking down the street and we fall and trip and hurt our legs, automatically we know, oh, my leg is hurting me because I fell earlier, on my way to the bank or so have you. If you're having a stroke, you don't know what's happening. The person next to you may or not know what's going on. So someone near you may notice and should call 911 immediately. A stroke does not often cause pain, and it should still be taken seriously and taken care of at once. Signs and symptoms: numb or weak face, arm or leg, mostly on one side; trouble seeing with one or both eyes; trouble speaking; confusion or trouble understanding other people; dizziness; loss of balance or coordination, or trouble walking; severe headache, comes on for no reason. So now we get into the our acronym here, FAST. So let me give you an example, right? Let's say you're having tea, coffee with a friend, a loved one, and all of a sudden you're having a conversation, catching up on your day, and they drop their cup of coffee. What do you do next? I was like, wait, is that okay? Maybe she just happened to drop it. But then you're noticing their speech is not, coherent anymore. And clearly we're just drinking coffee. We're not, drinking wine or so have you. So these are things that we should definitely be aware of in case we're in this situation and what to do next. So FAST. It could help you recall stroke's most common signs and symptoms. F for face. Ask the person to smile. Does one side of their face droop? A for arm. Can the person raise both arms? Does one arm drift down? Is their neck weak? S for speech. Ask the person to repeat a simple phrase. Is their speech slur or confusing? And T for time. Time is critical. Very important. Know the time when the stroke happens, symptoms first appear. Okay, so why is FAST important? Studies have shown that people who receive treatment within 3 hours of the start of the stroke symptoms were at least 30% more likely to recover with little or no disability after 3 months. So this is very, very important. The minute you're noticing something is not right, something's, It's better to be safe than sorry. Call 911 immediately. So some treatable risks to lower your risk of stroke. So high blood pressure, better known as hypertension, high cholesterol, smoking, obesity, and diabetes. Stroke, we always hear, oh, older folks, oh, my grandmother or somebody older getting a stroke. But in reality, it doesn't matter what age. You could be, 21. It's not as common, but it could happen at any age, given the factors. For example, your diet, if you're not taking good care of yourself, if you're a high sodium diet, not exercising, a lot of different factors could contribute it. There is no age. That's the whole thing. But you could always, it's more common here in the older population. But there is no age. It's not like, oh, once you turn 50, you might get a stroke. No, it could happen at any moment. So how to reduce the risk of stroke? So quit smoking. Um, we all know quitting can be a very hard and stressful thing to do for some. At HHAP, we offer a smoking cessation program where you could get one-on-one health coaching, support group, and we also provide patches and lozenges for free for those who are ready to quit. Do you know that after only 24 hours after your last cigarette, you have already decreased your risk of a heart attack? This is because of reduced constriction of veins and arteries, as well as increased oxygen level that goes to your heart to boost its functioning, which also means you're also decreasing your chance of stroke. And that's within 24 hours of your last cigarette. So can you imagine a week, 2, a month, and so on and so forth? Being physically active. So what does being physically active means? Well, according to the National Heart and Lung and Blood Institute, their definition is as follows. Physical activity is any movement that works your muscles and requires more energy than resting. So for example, walking, running, dancing, swimming, yoga, gardening, are a few examples of physical activity. So if you're home, throw on some music while you're sweeping and mopping, dusting your cabinets, just nobody likes to do these chores, but at least it'll be a little bit more enjoyable. Eating a healthy diet with low sodium intake at best. So we try to keep your low sodium content less than 2,300 milligrams, about a tablespoon. So to lower the amount of sodium in your diet, you could try to follow these tips when you go food shopping. Choose fresh instead of processed foods when you can. Uh, Use a nutritional facts label to check the amount of sodium. That's very important because sometimes you could buy a can of soup, and when you look at the recommended serving, the intake in the sodium is really high, so you have to like water it down. But some people don't do that. They just dump the can in the pot, heat it up, and then just eat it, and that's not the best way to do. And compare labels to find products with less sodium. Look for food label low sodium or no salt added. If you happen to buy canned vegetables, one quick trick you could do is just rinse out the can, get that extra sodium out of it, and then you could just continue to prepare it how you like.
Everything in moderation.
Keep your blood pressure in a normal range. If on medication, take your medications daily. Get in the habit of getting your blood pressure read. If you own a machine, check your blood pressure regularly. That way you're familiar with your numbers and you know what's normal for you, and everybody's normal is different. And keep your cholesterol levels in the normal range. How can you do that, you might ask? Well, limit foods high in saturated fat. Saturated fats come from animal products such as cheese, fatty meats, and dairy desserts. Tropical oils such as palm oil, foods that are higher in saturated fat may be high in cholesterol. Eat foods naturally high in fiber, such as oatmeal and beans. For example, some of those are black beans, pinto, kidney, lima, and others. And unsaturated fats, which can be found in avocado, for example. Okay, so we also have, if you're diabetic, controlling your blood sugar is very important. The importance of controlling your blood sugar if you're diabetic especially, it's important to keep your blood sugar levels in the target range as much as possible to help prevent or delay long-term serious health problems such as heart disease, vision loss, and kidney disease. Staying in your target range can also help improve your energy and mood. While figuring out what's your target range, please consult your doctor. It's important to speak to your primary care physician when it comes to any concerns or when looking for appropriate guidance when it comes to your overall health. And if you're overweight, we know that losing weight can be hard. So this is some recommended tips for anyone trying to get started with trying to lose weight. First, make a commitment to yourself. Losing weight takes more than desire. It takes commitment and a well thought out plan. Making a decision to lose weight equals, change of lifestyle, and becoming healthier is a big step to take. Take stock of where you are. Consider talking to your healthcare provider. He or she can evaluate your height, weight, and explore other weight related risk factors you may have. Ask for follow up appointments to monitor changes in your weight and any related health conditions. And three, set realistic goals for yourself. Some short-term goals and rewards efforts along the way. If your long-term goal is to lose 40 pounds and to control your high blood pressure, some short-term eating and physical activity goals might be able to start, eating breakfast. For example, some people don't eat breakfast. Taking a 15-minute walk in the evenings, and then for dinner time, instead of having rice, you could have a salad. Just little changes that you could do, that it's not something that's going to make you feel overwhelmed with the process. But one major thing that wasn't mentioned in what could help reduce your risk of stroke is stress management. At HF, we also offer meditation Mondays. But being able to manage our stress is something that's very important, because no one is immune to not being exposed to stress, being under stress. So it's good to pick up a hobby. It could be, knitting, crocheting. Some people color in a coloring book to alleviate their stress. You could even write in a journal. The moment if you're feeling, overwhelmed or stressed or something, jot down your thoughts. At least it's out, and you're able to, just get that off of you. In summary, always speak to your medical provider when creating a plan to help prevent stroke and other cardiovascular diseases.
This number that I'm going to give you guys can be for, because of the pandemic and all that we've been going through this past year, being at home, not used to being around our friends, socializing. We have this number for you: NYC Well, talks, text, or chat 24 hours, 7 days a week. This New York City hotline is available free of charge to anyone experiencing problems with stress, depression, anxiety, or drug and alcohol use. You can call 1-800 NYC Well or text WELL, WELL, to the number 65173. One, we would stay home if you're sick. Also, be mindful to keep social physical distance, which we know is stay at least 6 feet from other people. And that literally does mean when you put your 2 feet together and you walk 6 feet, that is 6 feet. If you're in the store, you want to stay that far from someone. The laundry, the clinic, the action center. You want to try to keep your social distance, and it does help. Also, we'd like you keep your hands clean. And by hand sanitizer, you want it to be at least 60% alcohol. Wash your hands at least 20 seconds with soap and water. Don't forget the whole happy birthday rule. Happy birthday, happy birthday. 20 seconds, nice and clean. There are free COVID 19 testing sites in all 5 boroughs. To find a site, you would visit nyc.gov/COVID tests. For the latest information, you can always visit nyc.gov/coronavirus.